Welcome to AZ Health Insurance Advisor. I'm your host, Roger Gates. Today I'm going to be talking about the difference between Affordable Care Act and what's currently available in the insurance market today. Again, my name is Roger Gates. You can call me anytime at 602-363-5908, or you can email me at rgates@aplanforeveryone.com with any questions or concerns. Okay, so this is going to be a little brief presentation about the Affordable Care Act versus the insurance that's available to everyone individually today as we know it. So I'm a local licensed health and life insurance agent here in the state of Arizona. I'm also certified as a counselor on the new exchanges or the marketplaces that are coming up here in the next week or so, opening in October. And I'm available to help my clients walk through any of those concerns right there. We're going to talk in depth about a lot of different things today. So at any point, anytime, you can write down questions, send them to me on email, call me. This is a pre-recorded meeting, presentation, so there's no live activity here. I will be having live video feeds on and off throughout the week, talking about updates and new things coming up in the Affordable Care Act. So it's important that you understand what healthcare looks like today, so that you can understand how this environment is going to be changing, so that you understand how that's going to affect you and your family. I don't know how many people have broken it down like this, but I think this is the best way to do this. So today, when an insurance company takes on a client, they assume the bulk of the financial risk for the continued good health of that client. And they do this for a small monthly fee known as a premium. Okay, and the client, on the other hand, makes a choice of how much of the risk they want to be exposed to. So it's generally smaller than the exposure the insurance company has. Okay, the insurance companies make money on the rule of large numbers. So the more people they have in the pool, the fewer the claims they're going to have to pay. By using underwriting to determine risk, they can choose which clients they want to insure and which they want to deny. So this allows the insurance company to be profitable in today's environment. The importance of underwriting is that it's a key factor in determining exposure to risk. So it determines whether the insurance company should either accept the risk and insure the client, accept the risk with limitations, so either insure the client but add riders to exclude specific coverage or for certain periods of time, or they can accept the risk and increase the monthly premium. So if you have a history of gallbladder problems and that sort of thing, and you put that on your application, which is you're supposed to do that, then they may rate you up on your premium, so you're going to be paying a little bit more than someone who doesn't have those type of problems. Or they could deny coverage altogether. So my role today as an insurance agent is to guide my clients into certain types of coverage based on the underwriting factors that they share with me during my interview process with them. So today we have a multitude of different options. Today I can offer a range of deductibles from $2,000 all the way up to $10,000, $12,000. I can offer a range of co-insurance. So 90-10, 80-20, 70-30, 60-40, and I'll explain co-insurance in just a minute if you're not, or in a few moments if you're not familiar with that. A range of co-pays. Multiple doctor's visits a year, 3, 5, unlimited, $35 copays, $30, $50 copays, $25 copays. There's a lot of different options that we have there. In and outpatient coverage, and a whole lot more we can offer today. So insurance today is based on the health and lifestyle of the individual being insured. What we believe at Healthcare Solutions Team that the environment is going to look like after January 2014, insurance companies are no longer going to have the protection of underwriting for their clients. So their exposure to risk is going to be a lot greater. Here's an example. If you were diagnosed with cancer and you had an opportunity to get insurance, are you going to jump on the bandwagon today, or are you going to wait until there's no pre-existing conditions and jump on the bandwagon? Yeah, you're going to wait and jump on it. So So the only way the insurance company ensure they're going to be profitable is by raising the premiums across the board for all their clients. And I'm going to show some examples of this later on. So again, no more underwriting. After January 1st, 2014, underwriting is going to be a thing of the past. Insurance companies will have no choice but to insure anyone who asks for coverage, regardless of medical history or their lifestyle. Two factors they're going to focus on: how much money do you make, and do you smoke cigarettes? That's it. Nothing else matters. And there's going to be 4 plans available on the exchanges. There's going to be a platinum plan, which is a 90-10 co-insurance. Means the insurance company pays 90%. You are exposed to 10%. So a real quick math: if you have a $10,000 deductible, you go to the hospital, you have a $100,000 doctor bill, you're going to pay your deductible of $10,000. Then you're going to pay an additional 10% of $90,000. So you're going to pay another $9,000. So your bill is going to be $19,000 out of $100,000. So gold is going to be 80-20 co-insurance, silver is going to be 70-30, bronze is going to be 60-40. Each of these choices are going to have multiple carriers offering similar coverage options right below there. So you're going to have Blue Cross Blue Shield, Humana, so on and so forth, Aetna, and these other carriers are going to be under each one of these: platinum, gold, silver, and bronze. And then the amount you pay each month is going to be based on income and exposure, not your health or lifestyle, unless you're a smoker. So now let's talk a little bit about the subsidies and the tax credits and the cost sharing reductions. Government subsidies and tax credits are going to be available to those families making, or those individuals making $46,000 or less. The sweet spot is going to be about $25,000. Individuals making about $25,000 are going to benefit the most from these new subsidies. Now families, they're capped out at $94,000. So after $94,000 they will not qualify for the subsidy. My personal opinion on what this whole Affordable Care Act is, let me share this with you real quick. It's just my personal opinion. It's not the opinion of Healthcare Solutions team, but I believe that it's a means of paying these insurance companies an exorbitant amount of money and putting the cost on the taxpayer. So these subsidies are paid directly to the insurance companies. They're not paid to the individuals. Now here's an important fact: grandfathered status. If your policy was written prior to March 23rd, 2010, before the Affordable Care Act was signed into law, your policy will be grandfathered. That means it will not metallicize into one of the 4 plans. But if you make changes to it, it will metallicize if you make a change to it into one of the 4 plans: platinum, gold, silver, or bronze. If you currently have a policy that's after March 23rd, 2010, you might not be getting the benefits of the new healthcare reform law. So you need to reach out to me, 602-363-5908, or you need to email me at rgates@aplanforeveryone.com so that we can talk and I can show you some of the options that are available today before January 1st, so that you can see all the options that are available and what type of prices you're going to be looking at. So here's another important fact: if you're probably paying too much for your insurance if you have a low deductible, and I'm going to explain a little bit about why we structure coverage the way we do. The statistics on deductibles are about 85% of the reason why people go to the hospital and hit their deductibles is because they were involved in an accident that resulted in catastrophic injury. Whether it's a car wreck, broken bone, you fall off a ladder, bit by a snake, stung by a bee, those type things. So those cause you to hit your deductible. Another 13% of the reasons why people go to the hospital is for a critical illness: heart attack, stroke, cancer, renal failure. That accounts for about 98% of the reasons people go to the hospital and hit their deductible. So what we can do is structure coverage just like you see here. We put together a major medical plan with a $10,000 deductible, keeps your costs low on your premiums. Then we also tack on an accident rider of $10,000 So if you are involved, if you are one of those 85%, that accident rider kicks in, covers your deductible. Zero out of pocket. The coverage is excellent. You get major medical coverage, and you're still covered from catastrophic events. Critical illness rider is also tacked onto there for at least $10,000, if not up to $100,000. And I'll talk a little bit more about how these things really work. So your exposure is little to none. Not true when it comes to lower deductibles. So lowering your premium by increasing the deductible to $10,000, I can lower your monthly premium, providing deductible insurance of at least $10,000 in an accident and another $20,000 to $100,000 in critical illness. I can almost eliminate any exposure that you might have. So here's an example of a plan today with a $10,000 deductible that I put together for a 46-year-old male non-smoker with no pre-existing conditions. As you can see here, $10,000 deductible, $10,000 accident coverage for $48 a month, and then we have $30,000 of critical illness, cancer, heart attack, stroke coverage for only $39.61. His total monthly premium, well, it also includes dental for $14.52. His total monthly premium is $200.41. Now with this policy, an accident with medical expenses at or below 10 grand is going to be a zero out of pocket for this guy. Above 10,000, his total out of pocket is going to be $3,500 because that's a co-insurance. Maxes out at $3,500. So if you have a $100,000 accident medical expense, you're only going to pay $3,500 for that exposure. Minimal exposure there. Now on the critical illness side, any medical cost due to critical illness, heart attack, stroke, cancer, pays you $30,000. So you pay the deductible and you pay your co-insurance and you put $16,500 back in your pocket. Now you can use that $16,500 in any way you see fit. You can use that to pay your mortgage, pay your car payment, keep your lights on, keep your family fed while you recover from your critical illness, whether it be cancer or a heart attack. You don't have to rush to get back to work. You've got a little extra time and a little extra money to help you get back on your feet. So zero exposure on something like this. Now let me explain, with the rise in genetically modified organisms going through McDonald's and Taco Bell and all these other fast food joints and eating these meals at the box stores, fries and bashes and all that, cancers are up. We've got the meltdown of Fukushima over in Japan. We've got radiation leaking into the ocean and coming across on currents, air currents. Cancer is just going up. Do yourself a favor. Go to a cancer hospital and just stand there for a half hour and watch the people coming in and out of that hospital. You will see a diverse number and age of people that are diagnosed with cancer. Protect yourself from it. If you're not doing it via your food, do it financially. So this same person, all I did here is I just changed the plan by lowering the deductible and removed the deductible insurance. His premium now went from $200.41 to $218.68 per month. His exposure on this is $5,500 for any medical expense. So if he's got a deductible of $2,000, he's involved in an accident, breaks his arm, whatever happens, goes to the hospital, and let's say it's a $7,000 bill. He's got to pay $5,500 of that $7,000. If it's a $3,000 bill, he's got to pay $3,000. So he's got to pay the $2,000 plus he's got to pay the co-insurance after the $2,000 deductible. So he's still going to have an out-of-pocket. Not so with the other policy. That's why we build it that way. Now let's talk about the Affordable Care Act. This is kind of a snapshot of what this looks like. Here's the same plan for this individual making $36,000 a year. He took the subsidy. He's going to take the subsidy. No additional coverage, dental, critical illness, accident coverage. His annual premium is going to be about $3,420 or $285 a month. He would also have a $6,350 max out of pocket for this major medical coverage. Now, if he decided not to take the subsidy, his premium is going to be $377.25 a month. almost double what he's paying with the policy I put together today. The difference between what I'm putting together today, especially that policy we just looked at, that's guaranteed to not change until the end of 2014. No premium increases and no benefit changes. Guaranteed by that company to not change. Again, if you want to compare apples to oranges, give me a call today, 602-363-5908, and I'd be more than happy to put some numbers together for you and let you see what you face coming January 1st versus what you're facing today. Okay? Now, the only thing that's going to be available on the exchanges, remember, and keep this in mind, is only major medical. You're going to need somebody like me to offer you other options. You know, these supplemental plans, these deductible insurance programs that I talked about, dental, vision, long-term care. These are not going to be available out there. And again, the Affordable Care Act doesn't offer these type things. Blue Cross Blue Shield. Here's an example. A couple of days ago, talked to a young man, 29 years old. He's got a $7,500 deductible with 60/40 co-insurance. Doesn't have any deductible insurance on this. He's got 3 doctor co-pays and he's got prescription medications on here. He's currently paying $48 a month. Blue Cross Blue Shield is now raising his premium for lower coverage, for less benefits. $151.55 is going to be his premium if he takes less benefits. Now, if he wants to take the same or more benefits, his premium is going to go to $352.55. Wow, what an increase! And this is going on right now today. On the other end of the spectrum, here's a 63-year-old female non-smoker. She had a $10,000 deductible, no accident, critical illness coverage, 60/40 co-insurance, and 3 doctor co-pays and generic prescriptions. She's a non-smoker. If she would have been a smoker, her plan would have increased from $188 a month to $751.71. Wow. Thank God she was a non-smoker. But for less benefits again, her increase is coming. She now has to pay $596.59 for less benefits. And if she wanted to get a more benefit-rich package, it would be $1,086.95 a month. So from $188 a month to $1,086.95. What an increase. This woman guaranteed needed to talk to me, and she's now in much better shape than she was with Blue Cross Blue Shield. Now here's an example of a family of 4 making $75,000 a year. They would currently pay a premium of $755 a month with the subsidy, if they took the subsidy for this particular coverage. Now this looks like ingredients to a cereal box. The amount owed by the providers is $7,540, right? $7,540. The plan would pay $1,040. So this family would be out of pocket $6,500. Now if you did the math on that, $755 times 12 plus $6,500, you're looking at about $15,560 just for having a baby. Whoa. That's a lot more expensive than if you just put the money in your pocket and paid for the baby. Don't you think? Now here's another example. The same coverage the Affordable Care Act is going to offer for this same family, paying $755 a month premiums. They're managing type 2 diabetes, which is a routine, well-controlled condition. Paying $5,400 is what they owe. Plan pays $50. Patient pays $53.50. Wow. Really? So why pay for the coverage? Why not just pay the penalty? It's only about $550. So pay the $550. You're going to still get stuck with the $5,400. You're going to save a lot of money not getting this coverage. So get coverage today from me for these type of events so that you can avoid this train wreck that's coming. Now, there's already been several delays in the implementation of this Affordable Care Act. Employer mandates have been delayed until 2015. The employer mandates are mandating any employers with more than 50 employees that they must get insurance for their employees or pay a penalty. It's a $2,000 penalty per employee. You think that's high? That's nothing. A typical employee, family of 4, it costs about $20,000 for that employer to insure that employee. Would you rather pay the $20,000 to insure that employee or pay the $2,000 fine? Most employers are going to start paying that fine. Right now, today, I just read an article yesterday that Walgreens nationwide is canceling their group coverage, and they're telling their employees that they need to go out and find individual health care coverage. The great thing about Walgreens is they're now going to reimburse their employees for a portion of their premiums. So they're trying to look out for their employees, and they're just going to pay the fines. The max out of pockets, $6,350 is the max out of pocket or the deductible for an individual. $12,700 is the max out of pocket or deductible for a family. These have been delayed. Don't know how long, months, maybe till 2015. Not sure yet. Here's another interesting tidbit. The House passed just last week, which today is the 20th of October. The House passed just last week that they're delaying the healthcare subsidies. Okay? So that means if you qualify and you apply for the subsidy, there's no guarantee that you're going to get it. Whoa. Why even get on that train? You don't even know if you're going to get reimbursed. Now here's some more information. The Inspector General for the Department of Health and Human Services has got a serious question about security on the subsidy application. There's a 15 to 20 page application that you need to fill out. And let me tell you this little bit of information. The navigators, they're hiring hundreds and thousands of these people across the country to work on the exchanges to help people with these applications. They're not doing background checks. They're not doing background screenings. So you're going to be giving all your financial, your personal, your private information, everything to these people on these 15 to 20 page applications applying for these subsidies. Whoa, another red flag. Maybe not. Maybe we might want to take a step back on the sidelines and wait and watch and see what happens. Now, if there was such a way to do that, would that be something that you'd be interested in? Taking a step back and watching as this whole thing unfolded. I can do that for you. I have plans today that are guaranteed, like I said, guaranteed not to change in premiums or benefits for at least until the end of 2014. Doesn't seem like much, but I don't know what's going to happen with this new Affordable Care Act. I don't know what's going to happen with its implementation and its rollout. Again, they're going to test it the day before they open the exchanges. Oh man, something on this scale, they should be thinking about this months in advance. They should have been testing this thing months ago. Not right now at the last hour. So you need to reach out again to me. It's rgates@aplanforeveryone.com or 602-363-5908. And this is, Roger Gates would be the person that you're looking for. I am a licensed health and life insurance agent here in the state of Arizona. So here, what I want you to do is I want you to get more for your money. So even if you have current coverage and you think that everything is being met and your budget's being met and everything is all good, I think it would be a good idea to reach out. At least get a free evaluation. Look at what's available. Look at some of these new ways of looking at it, health insurance. Look at some of this deductible insurance. How is that going to help you save more money, put more money back in your pocket? In this economic environment, that is critical for you, for your family, for everybody involved. Okay? So get back to me. Call me, 602-363-5908. So what I want to do is I want to offer you the same level of customer service and dedication that I offer my current clients. I'm going to give you the best that I can. Okay? Even you can even if you're happy with your current policy, you can even boost your coverage by looking at some of this deductible insurance as a standalone. This can help you cover some of your out-of-pocket exposure. So how do I cover my clients? I determine their individual needs based on their health, their budget, and just getting to know them with a short interview. My commitment to my clients is I'm going to provide the best possible coverage at the most affordable price. But after January 2014, my options, as well as your options, are going to be limited, as you can plainly see. As your agent, I can offer you coverage today, like I said, that's going to be good through December 2014 with no changes in benefits or premiums. That gives me, the professional insurance agent, an opportunity to keep my finger on the pulse of this whole thing and make sure that you are getting the best that you can get from what's available out there. Okay, I work for you. So all you need to do is get in touch with me, and I've got some information I can send over to you. We can get this thing started, and I can possibly offer you some advice and some direction. Here are some of the common questions that I typically get. So I'm covered through my spouse. What's going to happen to group coverage in 2014? We're looking at the actuaries right now. About 60% of the businesses out there are going to cancel group coverage. So you're going to be forced two things. You're going to pay a higher premium. You're going to be kicked off the group coverage. They're going to cancel that, and you're going to have to go find your own coverage. Don't wait till 2014 for this to happen, or you're going to be forced to get one of the 4 metallic plans: platinum, gold, silver, and bronze. You won't have a choice of what we offer today unless you call me. I have plans, I have options right now. Even if you have pre-existing conditions, I can help you. How will you know that you can trust the navigators? You can't. They're not background checked or screened. My recommendation is do not trust the navigators. Call someone like me. Again, who can you trust? Licensed, state licensed insurance agents. Those are the people you want to trust. Brokers. So what if you get out of that job and you want to find another one? If you have current coverage, you don't have coverage, do you have individual coverage? No coverage at all? You got to call me. We got to talk. We got to come up with a plan. It's going to be based on a lot of different factors. We've got to come up with a solution for you. So that does it for today in this presentation. I hope this was very helpful to you. Again, this is Roger Gates with AZ Health Insurance Advisor on Ustream. Any questions or concerns, please call me at 602-363-5908, or you can email me at rgates@aplanforeveryone.com. Again, local licensed insurance agent here in the state of Arizona, representing Healthcare Solutions Team. Thank you.